Healthcare officials are closely watching the numbers, especially in Jefferson County. I spoke with Dr. Wesley Williford, Medical Director of Disease Control at the Jefferson County Health Department, about the mask mandate put in place during this second wave of the pandemic, also the strain this virus is putting on local hospitals.
So far, the total number of cases that we've had in Jefferson County is 11,650 cases with 225 deaths so far. What we've been seeing at the state and county level is a slight decrease in the number of daily and weekly cases, new cases, over the past couple of weeks. Here in Jefferson County, our peak really seemed to peak of this wave of it really seemed to be around between July 5th and July 11th. That's about 1,963 cases. That has gone down to July 26th and August 1st to 984 cases so far. We'll be keeping an eye on that, but we've seen a general decrease in the number of new cases per day. And right now we're averaging around 150 to 200 cases per day. Still very high, still a long ways to go, but certainly better than where we were at the beginning of July.
The cases are really not dropping significantly, or the numbers. What does that tell you about the mask mandate and the gathering orders?
So I do think that we're seeing some benefit from the mask mandate and the gathering order, more so the mask mandate. I think that's where we're seeing most of our benefits so far. I think that's why we pulled off that very high plateau that we saw at the beginning of July. I think it really gives credence to continuing to do that whenever we're near other people, especially outside of our own household. I think it's shown to be very effective. And I think also some new data has come out on that from the Centers for Disease Control. There's a study that was published on July 17th of this year, talking about two people in Missouri. They were hairstylists who were taking care of their customers. Both of them ended up testing positive for COVID-19 and having symptoms for COVID-19. The interesting thing, though, is that they were wearing facial coverings as well as their customers. There were 139 customers. Of those, none of them reported symptoms for COVID-19, and about half of them were tested and did not test positive for COVID-19. So you have to think about that. Two hairstylists working with their customers very close to one another, breathing the same air, were not able to pass on COVID-19 in that situation with the use of facial coverings. And I think it's also important to note that the hairstylists, the people who lived at home with them, where they did not use facial coverings, they did go on to develop COVID-19. So really seems to point towards how effective masks can be at slowing down the spread of COVID-19.
Even with evidence like that we're seeing more and more of, there is still a large percentage of people who just don't think that the mask will work for them. What do you want to say to those people?
I really want to say that, I think there's a lot of misinformation out there about masks. I know a lot of people have said that it impairs your ability to breathe or exchange oxygen for carbon dioxide inside your lungs. And that's just not true. You look at our hospital workers who are over at the various hospitals throughout Jefferson County, working 12 plus hours every day, wearing masks the whole time. They're not dropping dead from the use of masks. They're doing quite well, other than having to work all the time. So there really are very few conditions that where a person cannot wear a facial covering of some sort. If I had to peer into a crystal ball, I think the mask orders are going to stay in place for a while. I think we're going to have to see a very massive decrease in the number of new cases per day before we talk about removing that.
Do you think we'll have to see another shutdown, a partial shutdown, like we're seeing in other states across the country?
I think at the end of the day, it's really going to depend on our healthcare system's ability to be able to handle a lot of patients with COVID-19. Currently, the healthcare systems in Jefferson County are all straining to be able to handle the patients that are currently coming in. And so at any moment, we could tip over and have a lot of cases all of a sudden. So it's really going to require a lot of diligence going forward to stick with this and to try to avoid something like that happening.
If the numbers do go down, let's say over the next 2 weeks, what is your opinion about schools reopening? Will children and teachers be safe at school together?
Is it going to be perfectly safe? No, it's not. I mean, I think that's just being clear-eyed that in-person school, when you have a lot of people all together, that there is some risk of COVID-19, and the schools are working diligently to create plans to minimize that risk. But I think it's going to be very hard to bring the risk all the way to zero.
And when it comes to testing capabilities and turnaround times for the results, Dr. Williford said there's a lot of demand right now on suppliers for the chemicals they use to perform the tests. So he's hoping to see some improvement as companies begin to expand. However, he does believe that we'll continue to see some difficulty with this for some time.